under 65 health. Medicare open enrollment, been going on for a while now, right? But under 65 health insurance open enrollment started yesterday. There's actually just as much buzz, if not more, in that market if you're able to capitalize on some of it. And it's a great market to make some extra residual income because there's a lot of confusion as to what people should get. People think there's some kind of magical unicorn plan out there, but there's not. There's Obamacare, short-term medical, and indemnity health. And then there's healthcare sharing ministry, like Medishare, which we don't sell anymore. Several years ago, you would write Medishare because it would exclude someone from having to pay, or it would exempt them from having to pay the penalty. Well, not long after Trump took office, they did an executive action. They got rid of the penalty. So once there was no penalty for not having an ACA or Affordable Care Act plan, there was not as much zeal in the healthcare sharing ministry space. So went back to indemnity plans for a while because short-term medical was limited to 3-year stints in most places, or 3-month stints, so they even got to a point where you could do 3-month stints, but they'd bind them into 4 policies. That meant your deductible was resetting every quarter, which is just not good. But I mean, some people still did it because they didn't want to pay for the ACA plan. Well, the indemnity plans have gotten a little bit less competitive in several states, especially around here, because the short-term medicals now go out to 3-year plans, 3-year health insurance plans. So it's still short-term. It's a 3-year, 3 years. Most people don't think about 3 years. They're like, I just kicked that can down the road for 3 years, right? So short-terms work fine. Who fits in what category, right? Who should be best, on an ACA plan versus not on an ACA plan? Well, really, mostly comes down to subsidy qualification. So if you go through our Health Sherpa link, which if you don't have, email me and we can send it the Health Sherpa link. But if you go through there, you can do a quick subsidy calculation. It's real easy, super easy. You just click quote, you put in how many people are in their household. Doesn't matter how many are signing up, it's total number, because they're doing it based off of the tax qualification. A household of 4 has a different federal poverty level than a household of 2. Okay, so it's based off of the size of their house, the age of the people applying, and their income, their adjusted gross income. One thing that can get people in trouble on the income is when you say adjusted gross income, pretty much just say that's all your income. Just tell me all your income. Because if you try to get into what qualifies and what doesn't, they'll try to, and you don't really ask them enough. Sometimes there'll be somebody that's like taking a distribution off of a 401k or something, and it's taxable income, and it messes their whole thing up. So don't get into the only portions that are exempt from modified adjusted gross income, which is what they use, are like alimony payments and student loan repayments and some weird stuff like that. So it's almost not relevant to even bring up those. So we're looking for what their income is so we can see what their subsidy qualification is. If they qualify for a really good subsidy, it can not only subsidize the price of the health insurance for them, sometimes it can subsidize the out-of-pocket, meaning that the deductible or the co-pays or the maximum out-of-pocket or the co-insurance is reduced to where they have less out-of-pocket and less premium. Those clients are some of the easiest to help because you can get their cost way down, and then you can cross-sell them things like, let's say they have a $2,500 maximum out-of-pocket. Well, now you can cross-sell them like the Heartland Hip with the $2,000 hospital admission, cancer rider, all of that, and you've just filled their void there. And then maybe they want a dental, vision, and hearing policy, right, with Manhattan or something. So you've written 3 policies, and you got the ACA plan, and you got the dental and the Heartland Hip. And I mean, you guys know how those pay. It's well worth the time to do those plans. And sometimes you're doing it for a family, so you could do like a family Manhattan Life out-of-pocket protection plan or something like that. Anyway, that's well worth it. But if they don't qualify for a lot of subsidy, so we call these the healthy and wealthy, people who are really healthy or pretty healthy, and they make too much money to get a subsidy, a lot of times they don't want to pay full price for Obamacare, because Obamacare without a subsidy is expensive. So a lot of times they will entertain short-term medical because they can get a lower premium, still cover themselves for if something big happens, and everybody's happy, right? They saved a little money. For you guys, you can also cross-sell with those things right there within the National General, or that's the one I would lead with, the National General portal. On short-term medical, you do want to tell them, like, there are pre-existing condition clauses on this. That's why I say it's for healthy and wealthy. It's not for people who are really, really sick. Okay? There are health questions that will prevent them from getting it, but even if they have some health problems, they still make their health questions. There's a pre-existing condition clause within short-term medical plans. Now, if they don't have any pre-existing condition clauses, this is what people say, well, I don't want any pre-existing condition clauses. Do you take any medicine? Do you have any pre-existing? No. You don't have a pre-existing condition, so the clause can't be used against those people. You see what I'm saying? So some people are scared of that word, pre-existing condition, even when they have no pre-existing conditions, just because it's been in the news too much. Now there's a caveat here. There's a person that's hard to help. The sick and wealthy. They're hard to help because they're probably going to have to get Obamacare. And you're probably only going to be able to cross-sell them dental. I had one come in not long ago. She had cancer, and she made like $270,000 a year, and I had to get her on an ACA plan. She's like 63, and it was like $1,100 a month or something, with like a big deductible, like a $6,000 deductible or something. So, but she had cancer. I mean, what are you going to do? You have to have it. So those are the hard ones to help. The healthy and wealthy are great. The poor and whatever are fine most of the time. Now there's another one that's really hard to help in Mississippi. When Obamacare happened, it called on all the states to expand their Medicaid program to pick up the people that made too little to be registered on the subsidy graph for Obamacare. See, the subsidies start at a certain federal poverty level. But if you're under that, meaning you make even less than that federal poverty level graph that they've set up, which you don't have to understand the graph completely, it's too complex. You let the calculator do the math. But if they make too little, for instance, if you have a family of 4 making $20,000 a year, they're not going to register on the subsidy levels. And you cannot fake their income being higher to get a subsidy, because they don't qualify for it, and it will be rectified when they file their taxes. And that means they'll make them pay it all back. Any kind of subsidy they get that they didn't know they weren't owed, they will have to pay it back. If they're under that and they're healthy, yeah, they could get short-term medical or something, but a lot of them, family of 4 making $20,000 a year, are going to have a hard time affording that. Now, a family of 4 making about $35,000 a year, they're going to get hooked up. Free insurance, woo-woo, it's going to be great. But if they're making under 20, it's going to be bad. I had one that was a family of 4 one time. The wife didn't work. I don't know why. The man worked at McDonald's, and they made $16,000 a year. I'm like, I don't even know how y'all are getting by on this. It was impossible. But it couldn't help them. They couldn't afford ACA plan at full price. They couldn't afford short-term medical. They couldn't afford any of that. So. And they make too much for Medicaid. Now the kids will get Medicaid. If you're making that low, and a lot of times too, what you'll see with the ACA side when you're doing the calculation for the subsidy is sometimes the kids, they're telling them need to be on CHIPS, which is the Children's Health Insurance Program, the Medicaid side. So they have to go do that through Medicaid. We can't help them do that. We would just be getting the parents' coverage. That's if they fall within a certain income range. Family of 4, just off the top of my head, somewhere around 30,000 to 50,000, 45,000. Those people, their kids go on Medicaid, but they get a big subsidy for Obamacare. There's a point where they make too much to get Medicaid, and then their kids get subsidies on Obamacare as well. But that's the two categories, man. You know, a lot of people make it too complex, and they're like, well, and so here's a question I get a lot, like, well, what is a permanent health insurance option? You know, permanent health insurance option for somebody who can't get the Obamacare subsidy, just something they can keep forever. Well, they can keep an indemnity plan forever, but it is not major medical. What makes a plan a major medical plan? To me, so a short-term major medical is a major medical plan. It doesn't cover pre-existing. A major medical plan has a stop loss. It has a point in there where they say, okay, now you don't have to pay anything, at least up to a certain amount. It doesn't mean having a deductible. An indemnity plan can have a deductible. So an indemnity plan, what an indemnity plan is it means we pay a fee for each code that you put on the bill. So if it's within our policy. But an indemnity plan like Philadelphia American has an indemnity plan where they can say, well, you got a $5,000 deductible, but all that means is we're not even going to pay your indemnified benefit until you're out $5,000. You know, now sometimes they'll have like a $5,000 deductible on hospitalization only portion of it, and so it'll pay some of the other stuff. But those indemnity plans are not major medical because they don't have, you know, something that says this is your maximum out of pocket. So like with a short-term medical or an Obamacare plan, you'll normally see, okay, you got a $2,500 deductible and a $5,000 maximum out of pocket. So you're paying 100% up to $2,500. Then you're paying, you know, whatever it is, 70%, or they're paying 70% of your bill, you're paying 30%, but your 30% is limited to another $2,500 or another $5,000 or however it's set up. But that's how health insurance works on the major medical side. Indemnity plans are permanent because they're guaranteed renewable until somebody goes on Medicare most of the time. But they're not major medical. They're great to, ideally, if you could pair an indemnity plan with a short-term major medical or an ACA plan, then, you know, they have some permanence of coverage. The Affordable Care Act isn't technically not permanent either because it has to renew each year, and they could terminate it at the end of any year. So the only thing that's really permanent are those guaranteed renewable indemnity plans, but they're not major medical. So you have to figure out what makes the most sense. But when people always ask me that, what's permanent? There is no other permanent option. Anybody telling somebody out there that there's a permanent option is selling an indemnity or short-term medical combo, and they're not really, and most of the time, I'm not going to name their names, but there's some agencies out there that do it like that. They sell it that way. The agents don't even understand that what they're selling is not permanent. Because I've had one of them come in here and talk to me about it. She don't know what the hell she's selling. She just doesn't know. But if you can do, I love it when I can sell and better Obamacare and cross sell some stuff with it, because I know they're going to be taken care of. If the metaphorical Shiite hits the fan when they have Obamacare, they can't use pre-existing conditions against them. You know, so a lot of people say nobody takes that Obamacare. That's not really true in this area anymore. Most of the doctors and hospitals take it. There's nothing else that they take unless they get a group plan, a group like a big group Blue Cross or group United Healthcare or something like that. That's a different story. But the Obamacare, for me, I prefer writing those. Some people just are not going to do that, and so then I try to do short-term medical. You just want to make sure that they're pretty healthy, because you don't want one of your clients getting declined a huge payment for a pre-existing condition. I'm trying to think. I have one right now over the short-term medical on a family of 4, and their 23-year-old daughter got into a car accident. She's like hospital. She's in the ICU. She's about to be moved to acute long-term care, and but she didn't have any pre-existing at all. I mean, she was a perfectly healthy girl, and between them and some 18-wheeler that hit her, you know, their property and casualty coverage, she's going to be taken care of. But then I've had other ones where we've had short-term medical rescissions or whatever from people not telling the truth on the health questions. That's a different thing. One of these days I'll do a video on rescission versus pre-existing condition denial. Those are two very different things. And I think some people mix them up in their heads as to what happens there. Rescissions are very uncommon, but pre-existing condition denial somewhat common if you're writing indemnity plans and short-term medical. Because some of these people do have, like if they had a kidney stone last like 6 months ago, and they get a short-term medical plan, and now they need a kidney stone operation. That's a pre-existing condition.
You're welcome.
And they can deny the surgery. Now, if they have had nothing, then they can't deny.
I like Harlan's question about, have you had anything that would have caused a normal or regular person to seek medical attention?
Yeah.
Any of the above questions?
But I mean, how is that even like pursuable? Like, I mean, I guess that's almost like a, open case question for them, but.